He can be seen on social media such as TikTok, offering his expert opinion and advice on plastic surgery to people all over the world. And he's here with us right now to share the latest advancements on breast augmentation and how it can be less invasive and reduce recovery time. Good morning, Dr. Chidi. How are you?
Great. How are you doing?
I'm very well, thank you very much. So could you share with our audience how exactly muscle-preserving breast augmentation techniques are, what they are, and how they differ from traditional methods?
Yeah, definitely. So when you hear the term muscle preserving, essentially we're not going in and cutting and placing the implant under the pec muscle. We're leaving your pectoralis muscles down, and we're creating a pocket just above that space. It's called a subfascial augmentation, where we use the muscle lining of the pec muscle and elevate that. So we're not going directly into the breast tissue. We're not doing the old school above the muscle technique, but we're actually elevating that fascial tissue and creating this nice space. So in that sense, it doesn't cut any muscle. So there's no muscle pain from any muscle being cut. And for a lot of active women, this is great because we aren't going under the muscle. They're not going to have issues with exercise, or even active moms where they're having to lift their kids and whatnot. They don't feel that pulling because the implant's not under the muscle. So the recovery is a lot quicker. They get back to powerlifting, CrossFit, whatever, at 6 weeks post-surgery. And because they're not cutting muscle, again, the pain's very minimal. So the swelling is less and the recovery is just overall awesome.
Yeah, you kind of alluded to that a little bit there. With these new techniques, how do they benefit regarding recovery time and overall psychological well-being?
Yeah, recovery time, at least what I've seen in my patients, is a lot shorter. You know, the traditional method is under the muscle, and I still do those procedures for certain patients, but I offer both as options. But the recovery time, yeah, it's really shortened because they don't have the pain of the muscle being cut, and so they're really able to get back to normal. And psychologically, when they're not feeling that constant pull of the implant under the muscle, they have less of what's called a mind-body dissociation. So they just feel like these implants are very natural. They almost forget they have them. And I've had a lot of women who had implants under their muscle before. When they converted to the subfascial, their muscle-preserving pocket, they said it felt way more natural. So that's how we can also compare. You've seen patients who've had both, and they just love the feel of the subfascial augmentation.
You just mentioned that the patients have a positive reaction to this procedure. So what is the various feedback being from clients who have undergone it?
They love it. They're so happy. They said they would do it again. The recovery obviously is shorter. They don't have anything to compare it to a lot of times because they've never had it before. But they recommend it to their friends. I mean, my practice in the last couple of years, I've almost gone completely subfascial. Again, I offer the submuscular for certain patients. Maybe they're a little bit thinner, and so they need more coverage of the implant. But for the most part, over 90% of my patients are doing subfascial, and they love it.
We've already touched on the benefits of this, but what other impacts does this method have on potential complications that would normally arise during traditional surgery?
Yeah, one of the complications we see with an under the muscle technique, the traditional technique, is what's called animation deformity. I did a recent TikTok about this specifically. But what happens is when women try to activate their pec muscles, whether they're lifting their children, doing something or exercising, the implant actually gets pulled into their armpits, and it can be unsightly for the patient. And it also feels strange. So this is a complication we don't see in the subfascial or muscle preserving technique because we're not doing that to the muscle.
Just very quickly, we touched it at the top and you just mentioned it again. How has TikTok helped you to connect and inform patients and the general public about plastic surgery?
Yeah, since I started doing TikTok in 2019, I really tried to make it a platform where I could help educate the public, because there's a lot of misinformation out there coming from non-experts or people that aren't in the field of plastic surgery. And so I really try to utilize that and create content that could be shared by potential patients, by the public, and educate them. And a lot of people have messaged me saying, hey, thank you so much. Like, I ended up going to Dr. So-and-so in a different state, but at least it helped educate them and prepare them to know to ask the right questions, to know what to expect from surgery. And all these things are just to help patients across the nation.
Well, thank you for your time this morning. To connect with Dr. Chidi about his clinic or on social media, visit the website on your screen right now.